terms of the heart exam, we're going to be evaluating the locations on the heart where pulsations are felt to and or sounds are better heard. These are not the actual location of the valves, but rather where we can get the information on the chest wall. So we're going to come to the sternal angle first of all. We need to find the angle of Louis. Is it okay if I touch your chest because I'm going to be performing a heart exam? I'm going to slide down off of the jugular notch to the angle of Louis and then 45 degrees into the intercostal space, and that will place you at the second intercostal space on the right, which is the location of the aortic pulsation. So for pulsations, we're going to feel with our finger pads, lub-dub, lub-dub. There should be a slight pulsation. It should not be accentuated. Then going back to the sternal notch, down to the angle of Louis, we're going to go over to the second intercostal space on the left, which is pulmonic. You would not go straight from right to left, because if the patient has a hemivertebrae or a scoliosis or some rotation, you may not be exactly in the intercostal space. So we go back to angle of Louis, second intercostal space. So now going to the third intercostal space, which is Erb's point, we would then pause for a pulsation. From there we go to tricuspid at the fourth intercostal space. And then at the fifth intercostal space, we come mid-clavicular line for mitral. Now, feeling for pulsations, we would then go from here to the epigastric area below the xiphoid process, placing your hand flat here towards the right shoulder. And we're going to feel for pulsations. If there was a pulsation coming inferior to superior and posterior to anterior, that could indicate an abdominal aortic aneurysm. If we feel pulsation coming from superior to inferior, as well as anterior to posterior, that could be coming from right ventricular hypertrophy. If the right ventricle has enlarged or we get shifting of the heart, we may feel a pulsation coming down. So once again, now we can move to thrills. Thrills we're going to be feeling with this portion of our hand. Same location, we find the sternal angle, come down to the angle of Louis, second intercostal space, feeling for a thrill. Now we should not be able to feel a thrill, that's why we're using a less sensitive portion of our hand. If we do, it could indicate that they have a grade 4 or greater murmur. Pulmonic. Finding the intercostal space, going down to the third intercostal space for Erb's point. Tricuspid. And fifth intercostal space for mitral. I can come in this way to be able to still have that portion of my hand on the chest wall, but if I cannot, due to the patient's habitus or they may have a lot of tissue, I can come in with an ulnar surface for mitral.